Good evening, my colleagues. My name is Majid. I am going to talk about international FRCS trauma and orthopedics, how to apply for it, new regulation, new format for the exam. First of all, I passed Part B FRCS orthopedics, which held in Dubai last June, about less than 1 month ago. I received this email from Royal College for passing the exam. International FRCS is called Joint Surgical Colleagues Fellowship Examination, or JSCFE. They changed its name in JMC to be INT, International FRCS, Trauma and Orthopedics. For my experience, I applied for the exam and I did my application in 2017. 2019, I passed the first part, which was MCQ and EMQ. In 2022, I passed second part this year. A very common question: what is the benefit of international FRCS? It is cost effective. There is any benefits for it? Of course, the answer is yes. This is the website of General Medical Council, JMC, in UK. If you search for JSCFE or you search for acceptable postgraduate qualification, you will find the first one is this one, JSCFE, Joint Surgical College Fellowship Examination. This is fellowship belongs to joint between the 4 Royal College in UK. So if you have one of the postgraduate qualification listed below, we can accept that as evidence that you have the necessary knowledge, skills, and experience to apply for full registration with license to practice. So there is benefit from it, is to register in JMC and to work in UK and Ireland, and also to get fellowship there. This is the website for JSCFE, which you will need to review and to know the latest update for this certificate, and to apply also for your application. As you see here, section 1, which is now MCQ, you have 4 attempts with no re-entry. Section 2, you have also 4 attempts with no re-entry. Here, the application. You will find link for everything about this certificate. Every question you want, you will find it. The same certificate also for cardiothoracic general surgery, neurosurgery, ENT, urology as well. The old criteria since 2015 up to June 2022, the difference is MRCS examination is not mandatory, but now it is mandatory, as you will see later. What is needed to apply for this examination? You need evidence that you completed locally registered high trauma and orthopedic training program. If you have MRCS, you need to give evidence for minimum 4 years surgical training. This is regulation of the exam for examination for first part is 2 exams, 2 papers on the same day. The first paper is 120 single best answer, 2 hours, 15 minutes, and paper 2 the same. Before it was MCQ single best answer and extended matching. Now both are single best answer. I think this is better. Section 2, you should pass section 1. It will be clinical part and viva part. We will detail it later. To apply for this FRCS, you need to make your application. You will register your personal profile on the website. You need your medical qualification, a photo or copy of it. You need FRCS, any college of one of Royal College. Also, there is application with 3 structured referee: your CV, your summary of operative experience, you will see it in next slide, your passport, photocopy for your passport. The 3 referee, the principal one is the one you are training under. Second one is something like head of department. Third is another consultant in your unit or the hospital you are working in. You need to fill the application. Part of the application will be filled by you and the other will be filled by referee. When you pass part 1, you will be you will join wait list for applying to part B. Unfortunately, in June 2022, so I think 1 month or 2 months ago, so there is revised criteria for international FRCS. Now MRCS is mandatory to apply for international FRCS. But if you applied already before April 2022 and we didn't pass part 1, if you didn't pass until January 2023, you have 2 options. First option is to complete FRCS Part B, but you should know that it is not recognized by GMC. Option 2, apply to take UK or Ireland ISB Section 2 in the same specialty. Here, how to fill your application. Section A completed by applicant, by you. Section B must be completed by referee. Principal referee is the head of department. Second one, referee is senior clinician you are working with. Third, senior clinician you work with. This is the form you will fill for your surgical experience. It will be part of the application. Here, different surgeries, total number, or have observed, carried out by supervision, you did independently. I advise you when you fill this form, don't use the numbers like 20, 10, 50, 5 or 0, they don't like. So both 51, 27, 33, 56 like this. Don't use numbers like 10, 20, 30. Okay. For the exam part 1, which is single best answer 2 papers, don't worry and don't get panic if you find very difficult questions, because it is expected. You will find questions with many correct answers. 1 or 2 is correct. After you finish your exam, this exam is revised again. This is the regulation and the parameters they are using for the exam. When I applied to my exam, I think they send me email that they cancel 18 questions. This is about 10% of questions, because the question itself, there is more than one answer is correct. So don't get panic. Many questions, it can be canceled. In this slide, slide email sent by 1st of June 2022 for update for the exam, because exam part B was temporary, stopped for 2 years because of COVID-19 lockdown, and they did the new update. Also in this email, they changed the exam part 1 from MCQ and AMQ to 2 papers, single best answer. This is to confirm that revised eligibility criteria, that FRCS is mandatory for new applicant. This is the options for candidate gaining eligibility to proceed from section 1 to section 2. This is sample single best answer question. The question will be like this. This is the first part. The question head is about 4 lines or 5 lines. Maybe the question was photo or without photo, clinical structure photo, clinical photo, or X-ray also as well. But most of question without any X-ray or any photo. Usually the answers are 5 and you choose from them. The exam is held in person view centers all over the world. And the exam in the screen on computer, it will be like this. And at the end, you have time also to revise your questions. As you see, single best answer AMQ. Now it is only single best answer. Part B or section 2 of the exam, it is held in a hotel. Last time it was in Meridian, Dubai. It will be, I think, same like this. Many tables, and you every time you sit on one table. The first day, it can be first day or second day. Clinical, it will be in 1 day, and oral or viva, it will be in next day or first day. One day is clinical examination, clinical intermediate case. Last exam was one case only, clinical, discussed in 20 minutes. Discuss first, who will give you scenario in 2 lines. You will use your skills to get history, then how to examine, then investigation, management, and is discussing every test you mentioned, why you ask about something in the history. Clinical short cases, 4 cases in 20 minutes. Last exam format, there was no patient because of COVID. I think after 1 year, it can be different. Short case, it was photo for something like deformity, swelling, or even X-ray. And we'll ask about how to examine. No patient in previous exam, but this will not be forever. Oral exam, it is a fixed format, 4 tables for 30 minutes oral, 1 table for adult orthopedics and spine, 1 table for trauma, 1 table for pediatric and hand, 1 table for applied basic science. Every table you will have about 6 questions with 2 examiners. Each examiner will ask 3 questions, and you will be marked twice for every question. So each table you will be marked 12 times, 6 for each examiners. Here, if you notice, there is 2 examiners and 1 observer, may be present or not. Now we will talk about how to prepare for the exam. There is many philosophies to prepare for the exam. Some candidates prefer to use books, paper. Some prefer to use electronic devices or websites. I used both. First, I used orthopaedics. Orthopaedics is a very large source, very comprehensive. They have many formats to deliver knowledge. The first is the website itself, as you see. Here, the topics, techniques, QBank, cases, videos, post evidence, groups, everything. And this is the application of orthopaedics you will find on App Store and Google Play. You can install it, and you will find it much easier than the website itself. The website, you can get the topics and question bank. This is a screenshot from the website. As you see, when you click topics, you will find trauma, pediatric, reconstruction. This is a trauma. I used trauma high yield topics. You will find a list like this. This is the questions, MCQ, with answers and with explanation as well. So after I study one topic, I get its questions. It will be much easier for you. Here, ankle fracture, 99 questions. No need to make get subscription or no need to pay for orthopaedics. I think the free format is enough. This is also the application. This is the topics. If you click topic here, trauma high yield topics, this is the question. If you press here, you will find all the questions. Also, some colleagues prefer to use the printout for orthopaedics. It is divided into 15 parts, 10 parts, according to the printout. You will find it in good font size. Also, you can put your notes, your highlights for this format, but try to get the latest edition. For trauma, I don't like orthopaedics. I don't depend over it. You can start by it. But if you want to get very good or adequately advanced trauma, the lectures for Orthopedic Trauma Association or OTA, you will find on their website. It will be very beneficial for you. Because trauma, they are calling it in part B, the black hole for FRCS. So the trauma could be the most difficult. So you get busy because they are expecting that you are practicing it every day. So the exam will not be very easy for trauma. So better to get very good source for trauma. OTA and AO. I think OTA is enough because AO principles included. Some candidates prefer Miller. Miller, it is available in book, 2 parts, very comprehensive, very concise, very nice. The problem only was the font size. This is YouTube channel. There is something. There is Miller course. There is Miller course held every year in many centers all over the world. It is recorded in videos like this, so you can study and watch these videos. It will save a lot of time for you. You can study these videos and study the book itself. It will be very nice for you. It is a very quick and very comprehensive also. There is a very nice book. We used it within the last 2 years, in the last months before FRCS Part B. It is also very good for Part A for single best answer, but you should study a larger source before it. Concise orthopedic notes, they depend that you study well in something with something like orthopolitics, and you can use this book. It is only in 2 parts, both parts about 500 pages. So it is a very comprehensive, very concise, very beneficial. It is one of the best books to study for FRCS. This YouTube channel, I owe my success in FRCS to this YouTube channel. This YouTube channel is based on weekly webinars held on Wednesday night. Every night, every week, one consultant is presenting one lecture, very concise and also comprehensive, about one topic related to FRCS exam. I used this YouTube channel and I repeated the videos many times. They teach you how to pass the exam. So I passed from first attempt because I use this YouTube channel. Also TV is a very good YouTube channel, but it is not focusing on FRCS format. This is only for teaching, but not related to FRCS. Also, the books of postgraduate, this is a very beneficial. We will discuss how to prepare for Part A and Part B in details in another setting. Okay, thank you very much.